Greetings, folks! Welcome to Brainetainment, your hub for unraveling the mysteries of the human body. Our mission is to provide fascinating insights into the wonders of our biology and foster a community of lifelong learners. We explore a wide array of topics, from the inner workings of our cells to the intricacies of human behavior. And today we're diving into a vital subject, one that's often overlooked. Why is it dangerous to drink alcohol while on medication? Stick around to find out. Alcohol is a common part of our social fabric, but when mixed with certain medications, it can spell trouble. Let's take a moment to understand the basic chemistry of alcohol and how it interacts with our bodies. Alcohol, scientifically known as ethanol, is a psychoactive substance that primarily affects the central nervous system. It slows down the communication between the brain and the body, often resulting in slowed reaction times and a lack of coordination. Now let's shift our focus to medication. The human body is a marvel of biological engineering, and medications are designed to interact with this complex system in specific ways. Some drugs block certain signals in the body, while others enhance them. Some replace missing chemicals, while others help the body get rid of unwanted ones. The way a drug is absorbed, distributed, metabolized, and excreted in the body is known as pharmacokinetics. This process determines the drug's concentration in the body at different times, which ultimately dictates its therapeutic effect and potential side effects. Now consider the fact that alcohol also has a significant effect on the body's metabolism. It can interfere with the liver's ability to metabolize certain drugs, either slowing down or speeding up this process. This can lead to either an increase or decrease in the amount of medication in the bloodstream, either of which can be dangerous. Moreover, both alcohol and many medications can have a sedative effect, slowing down brain function and leading to drowsiness or dizziness. When combined, these effects can be amplified, leading to potential harm. On the flip side, certain medications can also affect the way alcohol is metabolized in the body, leading to increased blood alcohol levels. This can heighten the effects of alcohol, leading to intensified intoxication and potentially dangerous situations. So as we see, both alcohol and medication have significant effects on our bodies. But what happens when they mix? Let's explore. When alcohol and medication share the stage in our bodies, the results can be far from harmonious. Now let's dive into the potential dangers and side effects of mixing alcohol with different types of medication. Firstly, let's talk about antibiotics. These are powerful drugs designed to fight bacterial infections, and they require your body's full attention to do their job effectively. When alcohol enters the scene, it distracts your body from this crucial task, potentially reducing the effectiveness of the antibiotic and prolonging your recovery. Now consider antidepressants. These medications are designed to balance the chemicals in your brain that affect mood and emotions. Mixing alcohol with antidepressants can amplify the effects of both, leading to heightened drowsiness, dizziness, and even increasing feelings of depression or hopelessness. Then we have painkillers. Mixing these with alcohol is akin to throwing gasoline on a fire. Alcohol can increase the sedative effects of painkillers, leading to severe drowsiness and other dangerous side effects. In some cases, this combination can even be fatal, but it's not just prescription drugs that pose a risk. Over-the-counter medications like cold and flu remedies, sleep aids, and even some herbal remedies can have harmful interactions with alcohol. These can lead to a range of side effects, from nausea and vomiting to internal bleeding or heart problems. And let's not forget that alcohol itself is a powerful substance. It affects your ability to think, slows your reaction time, and can lead to risky behaviors. When you add medication into the mix, you're potentially amplifying these effects. It's also worth noting that everyone's body reacts differently to alcohol and medication. Factors like age, weight, and overall health can all play a role in how you might react to this potentially dangerous cocktail. Clearly, the combination of alcohol and medication can lead to serious health risks. But why exactly does this happen? Time to delve into the science behind it. The science behind why mixing alcohol and medication is dangerous can be complex, but we'll break it down for you. When you consume alcohol, it's absorbed into your bloodstream and metabolized by the liver. This process involves enzymes, primarily alcohol dehydrogenase or ADH, which convert alcohol into acetaldehyde, a toxic and potentially carcinogenic substance. But your body doesn't stop there. Another enzyme, aldehyde dehydrogenase or ALDH, swiftly turns acetaldehyde into acetate, a relatively harmless substance which is eventually converted into water and carbon dioxide for easy disposal. Now let's introduce medication into the equation. Many medications are also metabolized by the liver, and some can interfere with the enzymes responsible for processing alcohol. This can increase the toxicity of acetaldehyde or slow its conversion into acetate, causing it to linger in your system and potentially damage tissues and organs. In other cases, alcohol can amplify the effects of medication, leading to oversedation or intensifying side effects. For instance, combining alcohol with sedatives or painkillers can dangerously depress the central nervous system, slowing breathing and potentially leading to unconsciousness or even death. On the flip side, alcohol can also decrease a medication's effectiveness. It can either speed up the metabolism of the drug, causing it to be eliminated from your body too quickly, or it can interfere with the drug's absorption in the stomach. Additionally, chronic alcohol consumption can cause long-term changes in liver function, affecting the metabolism of medications even when alcohol is not currently present in the system. This can make it difficult to predict the body's response to certain medications and may require dose adjustments. In a nutshell, mixing alcohol and medication can lead to a cocktail of unpredictable and potentially harmful effects. This isn't just about feeling sick or drowsy. These interactions can cause serious damage to your body, and in some cases can be life-threatening. So now we understand the risks and the science behind them, but what can we do to avoid these dangers? The dangers of mixing alcohol and medication might seem intimidating, but with a few simple precautions they can be avoided. So, let's delve into some practical tips and advice for safe medication use. First and foremost, always read the labels on your medication. These tiny print instructions are not just for decoration. They contain crucial information about dosage, potential side effects, and often warnings about interactions with alcohol. If the label says not to drink alcohol, heed that warning. It's there for a reason. Secondly, never underestimate the power of a conversation with your healthcare provider. They can provide personalized advice based on your medical history and current medications. Don't be shy about asking questions. It's better to ask than to assume and put your health at risk. Remember, it's not just prescription medications you need to be mindful of. Over-the-counter drugs and herbal supplements can also interact negatively with alcohol. So it's essential to mention these to your healthcare provider as well. Now let's talk about being aware of the potential effects of alcohol. Alcohol can make you feel drowsy, and so can some medications. When combined, this effect can be amplified, making it dangerous to perform tasks like driving or operating machinery. Always be mindful of how alcohol might amplify the effects of your medication. Also, try to keep a medication list. This can be a lifesaver in emergencies, and it can also help you keep track of what you're taking and when. Include everything from prescription drugs to vitamins and supplements. Lastly, remember that everyone's body is different. What works for someone else may not work for you. Always listen to your body and take note of any unusual reactions or feelings. By following these guidelines, we can ensure that our medication does its job without the added risks of mixing with alcohol. So there you have it. The reasons why it's dangerous to drink alcohol while on medication and how to avoid these risks. We've delved into the deep waters of how alcohol and medication interact and the potential dangers that lurk beneath the surface of this seemingly harmless act. We highlighted the fact that alcohol can alter the way medications function, leading to either increased or decreased efficacy. This can result in unexpected side effects, potentially exacerbating health issues rather than alleviating them. We also brought to light the importance of awareness. Being informed about the medications you're taking and the potential interactions they have with alcohol is paramount. Ignorance isn't bliss in this case. It could mean the difference between recovery and further complications. On a more positive note, we shared some tips for safe medication use. Remember to always read the labels and consult with your healthcare provider if you have any doubts. It's better to ask questions and be sure, rather than assume and put your health at risk. This conversation might seem a bit daunting, but it's a necessary one. Knowledge is power, and in this case, it could save lives. Thank you for joining us on this exploration. Don't forget to subscribe to Brainetainment for more insights into the wonders of the human body. Until next time, stay curious and stay informed.